Chelsea. I'm a doctor of physical therapy at Renew Physical Therapy, and today I'm going to show you my top 3 exercises for pelvic floor relaxation. So this would be good for somebody who feels like they have a lot of tension. It can be pelvic pain, sometimes even issues with leakage can be caused by some pelvic floor tightness. So we'll just jump in and show you my favorite 3 stretches that are easy to do at home, a couple of different modifications, and we'll go from there. So the first one I really like is a butterfly stretch, and you may have done this before just to stretch your inner thighs, and that can definitely be helpful, but whenever I'm focusing specifically on the pelvic floor, I like to have people make sure that they're breathing, using good belly breaths in to try to relax those muscles. So I will just have you kind of lean forward and then work on some deep belly breaths. Just breathing in and out through the nose, trying to think about the belly expanding and that diaphragm really working, and focusing in on the pelvic floor. If this is too much for your hips, you can also use some yoga blocks or some pillows and just give yourself a little bit of support underneath the knees. That way you can truly focus on just the pelvic floor relaxing. Because if you're feeling like you're holding too much tension through the inner thighs or even the outer thighs, it can really affect how you're able to relax that pelvic floor. So that's my first stretch that I love to do with people who have pelvic floor tension. You can do it on a daily basis at home. I usually just set like a 1 or 2 minute timer and have you work through breathing and trying to get those pelvic floor muscles to relax. The second exercise I really love is called child's pose. It's a common yoga pose. It can be good for the lower back, the hips, and it really specifically helps you relax your pelvic floor. So the way you would do child's pose, basically you are starting here, sitting back on the feet, and then just walking the hands out and letting the forehead come all the way down to your mat. So when you're in this position, you can really work on deep belly breathing, again, trying to relax that pelvic floor, just getting all the tension out of that area. Just like the butterfly stretch, I like to set a 1 or 2 minute timer. And that way you don't have to focus on counting. You can just really focus on the belly breaths to try to get all the tension to relax out of your pelvic floor. If that feels like it's too much strain on your knees, or you just feel like you can't get the relaxation, a great modification can be with 2 pillows. So what I like to do is have 1 pillow resting between your thighs and your feet. You can sit back on the pillow and you can see how that cushions you a little, so that way your knees aren't as bent as if you're just folding back. And also it just gives you a nice place to sit so you can really relax those muscles. And then you can take 1 pillow, sometimes 2 pillows. If you want to take 1, you can fold it on your chest and just lean forward until you really feel nice and supported. And again, just using that same breathing, stretching. This is just a nice modification if you're having a hard time feeling like you can get a full relaxation, or you're limited by knee pain or decreased knee range of motion. In pregnancy, this can be a great one. If you're having a lot of tension, or you're just preparing for labor and delivery and working on getting that pelvic floor to relax. Especially if you do a really wide-legged child's pose, as your pregnancy advances, you'll be able to accommodate for that growing belly. The last pelvic floor relaxation stretch that I really like is a piriformis stretch, or it's called figure 4 stretch. There's several different ways to stretch out these muscles. It basically helps stretch out those hip rotator muscles, one of which is right in your pelvic floor that can cause a lot of pain and tension. It can even mimic some like sciatica type symptoms. So if you're dealing with that, this one can be very helpful. There's a couple different ways to do it. I like just laying on your back, so I'll demonstrate how to do that on both sides. You might notice that one side feels stiffer or more tense than the other. So you'll just lie down on your back, cross one leg over, and then you're just gonna pull your opposite leg up toward your chest. So you'll feel this a lot in your hip, but when you're in this position, you can also work on really letting the tension go of that pelvic floor, relaxing between the legs there, hold for a 1 or 2 minutes, then switch over, same thing. Just working on that relaxation and really getting rid of that tension in the pelvic floor. That can also be done in the seated position. If you feel like it's too hard to lay down flat on your back, you can certainly do it seated in a chair. You would just cross the leg over, lean forward gently until you feel the same type of stretch. The key for all of these exercises is to really focus on the pelvic floor. Relieving the pelvic floor tension can be so helpful in helping you heal pelvic pain and helping stopping leakage. There's a lot of different things that can be helpful. If you still feel like you're having any trouble with any of these pelvic floor exercises, please feel free to reach out to a pelvic floor physical therapist to get a full evaluation, and that way you can really get care that's tailored toward you. Thank you for watching.